What's up, elite people? Let's talk about concussions. You know, there are about 4 million sports-related concussions in the United States alone every year. And that doesn't include concussions that come from car wrecks and playground accidents and all kinds of other things. And it's important to know what to do if you suspect or are concerned about a possible concussion. So concussions fall on the spectrum of traumatic brain injuries. And traumatic brain injuries have a very large spectrum, and they go all the way from a loud noise just went off next to my head and I have symptoms from that, all the way to things that cause death. Concussions fall way down in the low end of that spectrum, and they include the loud noise with symptoms, all the way up to the point where you would have bruising on the brain or something that can actually be seen on MRI or CT scan. Typically, people think of concussions as injuries that occur from physical contact to the head. And like I said before, concussions can also include loud noises. Now, those loud noises are really, really big loud noises, like big explosions. But technically, a loud noise close enough to the head and with enough magnitude can actually cause a concussion. And it's all about whether or not you have symptoms after that blow. Some common concussion symptoms include loss of consciousness for any period of time at all, headaches, visual disturbances, ringing in the ears, irritability or personality changes. And those are just a few symptoms among many, many others that are possible. If you or someone else has witnessed your child or someone else's child, or anyone for that matter, sustain some sort of a head injury, and you're concerned about concussion in any way, you should have that person seen by a healthcare provider. If you didn't witness it, let's say we're talking about your child and you didn't witness anything, but someone else has expressed concern and you see any of those symptoms or symptoms that may seem to be out of place, then your child or whatever person we're talking about really needs to be seen by a healthcare provider so that they can determine whether or not further testing is necessary. One important thing to know is that a very, very common misconception is that sleeping after a concussion is a bad thing. And in fact, sleeping after concussion is actually a good thing. In fact, the brain recovers best when we get into sub-REM sleep. And so it's just an important thing to remember that if your child or someone has been diagnosed with a concussion, let them sleep. Also, after a concussion diagnosis, it's important to follow your healthcare provider's instructions. Typically, symptoms of a concussion should clear up within a few days to a few weeks. And most concussions and their symptoms are temporary in nature. Very, very rarely do you have long-term effects from a single concussion. If you have questions or concerns about somebody who may have a concussion, we'd love to see you in the clinic. Check us out at elitedpc.com. Hey guys, if you like what you're seeing here, make sure you subscribe down below. Hit that notification bell. And as always, get fired up, because if you're not fired up, you are doing it wrong.